to send all our Picoryza papers to Dr. Mihirbai Joshi, because I think we have opened up something which we have worked on for so many hepatoprotective plants, and our work on Picoryza curua dates back both in vitro, vivo, and in the clinic, Arogyavardhini, and later on. So I think that Hiteship, if you don't mind, since you will have that, the last JIM paper, if you don't mind, just send it to, if Shobhaya doesn't have, and then Shobha see that Dr. Mir Joshi gets that. It's available in internet, but it becomes easier. So, and then we'll take it up that in one of our discussions on our Tuesday platform to take it further, because this is something which is very good. Dr. Pandey and others, V.N. Pandey, had shown what you talked about, that it becomes what you call it, hydrocholeric. Yeah, it's very interesting. Yeah. Dr. Meera, anybody else? Sharvari, Dr. Sharvari?
Yes, ma'am.
Any comment?
So it was really an interesting talk. It was a new topic, like very in-depth knowledge.
Yeah, for you it's new. For us, it is so many years.
Yes,
And
ma'am.
I wanted to get it to our platform, that
Yes.
one of the things that on Dr. Vaidya's birthday, 4 mantras, my first mantra was this, where Mihirbai appeared, and I have sent that slide to him also, that whatever we dig and which is covered, let's again uncover and start working on it.
Yes, definitely. Thank you so much.
Yeah. Shubhada, any comments from you, Shubhada? Sir talked about oxidized LDL. No, I think she's not there now.
Ma'am, I have a question for Dr. Joshi.
Yes.
Question is it possible to isolate these biocrystals intact in the laboratory from human fluids without disturbing the crystal structure? First thing.
People have isolated them, and they've studied extensively. And particularly the urinary crystals, they have done it. Hydroxyapatite, they have done it. And cholesterol, partly they have done it, because usually they are making a complex with the other compounds. So it is slightly difficult. But mineral crystals are very easy to isolate, very easy to isolate. And the first people isolated them. They took the powder X diffraction study for identification, and they identified them as a particular mineral crystals. And then people started working on the reverse manner, trying to grow the crystals in the laboratory, which factors are affecting the growth, and then inhibition and other studies. So that is what we are focusing.
And my next question follows this. Your lab-made crystals, which you showed in gels, do they truly mimic the biocrystals?
Yeah, in a certain aspect, they try to mimic the biocrystals. We know that in a human being, the things are very complex. And in a soft tissue, the crystals are being grown by supplying the nutrients from our body fluid itself. But in a laboratory, we have to mimic that situation by creating an environment of a soft gel. That is something like mimicking the tissue. And it is a porous one, so that the fluid is being transported, being supplied, and that nutrient or fluid is having a composition of the different nutrients, so that the usually the compounds are being supplied to the site of growth and the crystals grow. So it is almost a mimicking, not making the exact atmosphere. That is why the term is used, mimicking. It's not exactly the body condition is made. So body condition is always very complex, but we try to make it in such a way that we try to understand that how they grow.
Can
Sir,
we have the name of the person? Can you show your face and who's asking this question? We would love to see you.
yes, ma'am. I will do that.
Yeah, lovely.
Am I visible?
Oh, Dr. Meera
Yes.
was asking. Wow, very nice. Oh, madam.
Yeah.
I thought as much though.
Sir, my next question is this. Since you say you mimic the natural crystals, I just wanted to know because the osmotic conditions that you would be maintaining in your gel would not exactly be the way that it would be in, say, within a human system. So when you say you're using it to reverse crystal formation, is that going to impact
Yeah, it's a
the same,
it's a good
same way?
question. Good question, madam. That was when we started working on this system long back, because it's a big story. I met Dr. Vaidya nearly 25 years back in one of the conferences in Rajkot. And since we are from the same family, so we know each other. And I asked him at that time casually, are you working on kidney stone? He said, exactly not working on kidney stone, but I worked and I have a good expertise in kidney stone. Long back, I used to remember that he worked sometimes on kidney stones. Then I told him that one of my students is also working on the kidney stone. And then we started collaboration. And that collaboration started with his knowledge of Ayurveda, his knowledge of clinical pharmacology, and our knowledge on physics as well as characterization and growing crystals. And in a first lot, we did a very simple study, and that work is being published. And that work is published long back, means almost 15 years back. That is very simple work that we use different herbal extracts. But your question is very important, that how to mimic the condition. In kidney, it's a dynamic one. It's not a static one. The urine is being continuously generated, flows through the system. So we have to grow the crystals in a dynamic system. Another thing is that what are the conditions within the urinary tract or kidney? pH level, as you mentioned, osmotic condition. So again, we have to take a help of medicine or pharmacology people and try to create the atmosphere, the dynamic atmosphere. And we try to see that how crystals grow in vitro, not in a system. And we try to use the inhibitors, that how they try to inhibit it. Our system right now, we study it, it's a static one. But we want to have a dynamic system, as you mentioned, that using different conditions, pH level, then osmotic condition, all these factors we have to consider. Again, we try to repeat the thing. It will be much more nearer to the real situation. Not exactly the real situation, but nearer to real situation. So
Doctor, may I come in, Meera madam?
Yes,
Reverse pharmacology starts with clinical experiential data or exploratory data or case reports. So the plants we have chosen are used for centuries in kidney stone. So when we want to test it and we found it positive, it is already in human positive. And so defining conditions may be different. For example, as Meerbai said, in terms of citric acid, citrate containing fruits, all that. And but I would like him to say something of your interest. That is how microbes may play a role in crystal formation. Meerbai, please, because she's a microbiologist and she would be very interested there.
Accidentally, we found one interesting result, but somehow we could not work on that because of our less expertise. We were growing crystals of potassium tartrate and strontium tartrate in a gel beater. And we found the gel becomes dirty and some cotton-like thing getting attached to the crystals, and it stops growth of crystals. Then one fine day, I invited one of my colleague from bioscience department. She used to be a very good friend of mine. So I called her and they said something dirty is taking place, some cotton-like things, threads or something like that. Because we were not expert in that particular field. She immediately identified these are fungi. And these fungi are attaching with the crystals. It stops the growth of crystals. Then she identified the fungi and we published one paper by doing characterization of that. Later on, one of my students was working on a modern sodium urate monohydrate, and he experienced the same thing. And in a at one this monsoon atmosphere, some fungi attack took place, and it stopped the growth. But it did not happen again. So it was accidental or whatever maybe. Then we showed the result to sir, and the sir was very much keen, but it did not take place somehow because it was accidental one. So we were not expert to identify. And sir said that is a very important result. These fungi may be working as an inhibitor or maybe having some bonding on the crystal, some bonding on the crystalline surface, because now the molecular docking is a very important branch of chemistry. In that one, the active site of fungi as well as the crystalline molecule, they are being docked, and the potential energy, everything is being counted, and they try to do the modeling whether this site binding on the crystal and will inhibit the growth of crystal or not. So that is a theoretical one, and they are using different type of computer software, and they predict that this fungi or this particular microorganism will affect positively.
Yes, sir. That actually the reason that led me to this question was that if you've got just like opioids, you can have compounds from fungi, which probably can be used as pharmacological substances, which can be consumed if they are
Yes.
not toxic. You
Yes,
can
yes.
just consume them, and then probably they may act as inhibitors for, you need a foci for the crystal to form. If you can
Yes.
just stop the foci from forming itself, then there's no question of crystal formation itself. I mean,
So
I'm just throwing a wild idea, but I really don't know how much it can be translated. Maybe
Madam, your idea is absolutely important, and that we discussed with sir, and we found a similar type of result, but unfortunately, it was not observed again. That was an accidental one.
okay.
Meera Madam's question has raised some thoughts in my mind that when you have grown crystals, which we could see it in the test tube, and you showed the urine also with oxalate crystals. If you were to separate out those crystals from the test tube, would it have the same morphological features as that you see in the urine?
May not be same, because the conditions are different. Even for the kidney stones grown in different patients, some they are having a very rough surface, some are having a staghorn type of things, some are having a very smooth one. So different conditions, pH, temperature, then the nutrients being supplied, all complex things are taking place, and that is why the morphology changes.
So
But
one more question on that only. Then how do you characterize and reproducibility for that particular set of experiments?
But we are using the nutrients which are pure material supplied by chemist.
Right. That
So
is not
we are sure that
culture material is there.
it's not culture one. So culture material we are not using. So these are the pure material supplied by chemist, means a chemical supplier, and we are using that. So for example, calcium oxalate. So we use calcium hydroxide and oxalic acid. So by just reacting calcium hydroxide with oxalic acid, we get calcium oxalate. So it is a pure one.
Sir, instead, what if you were to isolate? I mean, you said it's possible to isolate these crystals from urine or from whatever body fluid. What if you would do the same experiment using patients' crystals? Would it
Yeah,
work?
it's a very good idea. But madam, I told you that different pathological conditions, physiological conditions, the crystals obtained in urine, they have a different shape and different particular conditions. So first we should have a patient history, under which condition these are grown in a urinary tract. And when we recover, then what was the condition of a urine? And on basis of that, we can isolate them. It may not be possible that the crystals isolated from one patient is having a same morphology, same condition from the patient recovered from other patient. So we have to first take the history of the patient as well as from the data collected. And then we try to do that growth inhibition study. Then we can identify whether it is occurring or not. It's a good thing.
Thank you, sir. Thank you.
Usually, madam, the crystals recovered from urine, they are having other components also. For example, uric acid, some proteins associated with our body, and some organic deposition also associated with the crystal. So it's a not pure crystal. And usually people have done the elemental analysis of crystals, and we have published one paper also by doing the analysis of the kidney stone, not crystal, the kidney stone recovered from a patient. And that gives that it is not a single phase compound. It's not a pure calcium oxalate, but it is having an impurity of other compounds also. And that impurity may play important role.
So, hydroxyapatite, which you were mentioning, is routinely used in many protein purification. Protein chemists routinely use this because you can generate hydroxyapatite in a laboratory with a very simple chemical reaction.
Absolutely right, madam.
But what happens is hydroxyapatite, depending upon the cross-linking, can act like a gel or a sieve also. It has some sieving capacity also.
Yes.
So
it is used, hydroxyapatite is used for the targeted drug delivery, for separation of DNA, and for many biological applications it is used, and it is a very important biomineral.
Right.
Madam, in fact, I have a set of the presentation where I discuss about the growth of hydroxyapatite in the laboratory. And we made a nanocomposite of hydroxyapatite. And as Shobha madam mentioned in the introduction, we made a composite of hydroxyapatite with curcumin. And we know that curcumin is having antibacterial, antiseptic, and many other biological activity. So we combine that with the hydroxyapatite, because hydroxyapatite is used as a bone ceramic material. So if you are using hydroxyapatite with curcumin, then you are having extra benefit.
May I come in?
Thank you, sir.
I think that this problem of microbes, bacteria, fungi in stones, particularly calcium oxalate, brucite, struite, urolithiasis. There is a paper in 2021, and earlier 2 years also there are papers. And actually, sometimes it is believed that you need the nidus of a microbe to truly have a reposition around it. And I think this paper I will request Shobha to send to you. And it is in Kidney, a very reputed journal. and it is kidney kidney 2098 to 298 to 311 2021 kidney volume 360 and 2. So if we get this, or even if you just put search as this, it has also given many references. It's an extensive review and a very good study also. They have also identified the microbes, the wonderful photography. I don't know whether you can see this or not.
Oh, yes. Beautiful photographs.
So it is shown that so there is an interest continuing in terms of and if you see here, there is a microbe which is actually inside the stone.
Yes.
And nearby recently it has been found that microbes are in many tissues. Up till now we felt that microbes only symbiotic microbes exist in lungs and now mouth, nose, skin and GI tract. But now they are finding in many organs actually by microbacteria, which even sometimes the species identification has not been done also. Same thing applies in this paper I referred to. So it is very essential to, if we want to review again, what is the current state? Because it is well known that those with urinary infection, they are more prone to stone formations. So I would say that the plants which we have studied and found very good effect, we have to continue further, and we may also take help of Meera Madam for microbiology part of it. Thank you.
And these true white crystals are because of the urea splitting organisms, and they are responsible for the certain microbes are responsible for this true white crystals growth.
Great. So, Mirba, it was an excellent talk, and you
Thank you very much.
generated a lot of discussion too.
I have one more talk that is on the much more technical one.
So
I have not.
we'll have a second talk in a due course of time.
But in next month we'll try to give.
Yeah.
Yes.
Because that will be much more technical. I have not given any data right now. This was an introductory one.
Yeah.
So I have not given any data in this particular talk.
Sure.
And I have one talk about the nanohydroxyapatite and its applications. So Madam suggested that nanohydroxyapatite is very important one for many biological applications.
Thank you very much, sir.
Thank you very much.
Thank you.
Thanks.
Thank you very much.
Yes, sir.
Thank you.
Yeah, very nice. Lovely.
Okay.
And since it will be recorded and it will be available.
Yes.
Right. Send it across to Dr. Mihirbai, of course. And then I don't know where Rhoda will know about it. Are we putting in our website or we are putting it, where do we?
Actually, it's a very huge file. So I will be sending it to everyone personally, ma'am, so that everyone can have an access to it. Since it's a huge file, we will not be able to upload it on the website.
So Shobha, we can upload it. We have a YouTube site also.
YouTube site.
So we can upload it there and we can send the
Yeah,
link.
then we should
sir.
keep it on YouTube.
We'll
Yes.
send the link to sir.
Yes, that would
Thanks,
be.
Rhoda.
Yes.
I will send the original link also. Also, this YouTube, once we upload it, we can send it to you, sir. That
You
also.
can have a two version. If you want to upload only talk and talk plus discussion, whatever is possible, then you can edit it and you can upload it on YouTube channel. So that will be giving a viewership on a larger scale, and
Yes.
people can have a view of that.
Sure.
Thanks.
Thank you very much.
Siddesh is there?
Yes, ma'am.
I will do this with Siddesh, maybe tomorrow or something. Yeah. Okay.
Sure. Thanks, Meherbai. Thank you.
Thank you very much. Thank you very much, Ramaben. Thank you.
Shobha, thanks, and thanks everybody.
Pranam Ashok Bhai. Yes.
Yeah, thanks.
So I leave the meeting. Okay. Thank you.